One of the greatest hopes for easing our way out of our bubbles is antibody tests, blood tests that reveal whether we've had COVID-19, perhaps with no symptoms. That might mean we're immune and can safely re-enter the workforce. There are dozens of antibody tests on the market now, but no government is using them widely. As Crystal Goomansingh explains, that's because what they can tell us for certain is still unclear.
People are clamoring to get these uncomfortable nasal and throat swabs. If the virus is active in your body, the genetic makeup should show up. If you've recovered, antibodies should be in your blood.
I saw that there was a test for antibodies. It was a very simple test.
Dr. Jean Carruthers is a cosmetic surgeon in British Columbia. This Canadian company and its antibody test caught her eye.
Something that we're all very interested in is getting Canadians back into their real world, but safely.
Dr. Carruthers, along with her colleagues, wrote to Canada's health minister advocating for BTNX. Health Canada has not approved the test. It's also not approved in the U.S. either, but it is being sold under the Emergency Use Act. In Europe, the company has a CE marking, meaning it meets European Union requirements, but that is not an approval.
Our applications right now in Canada are sales for Europe and the U.S. This is to laboratories and to healthcare professionals.
BTNX CFO Mitch Pittaway says orders shipped to the UK were for independent evaluations. UK Prime Minister Boris Johnson called these types of tests a game changer in mid-March, saying they'd be available soon. But the tests failed under scrutiny. The UK government is not currently using any antibody tests. The World Health Organization is examining a number of different tests, including the antibody test from BTNX.
No test is of any value if actually it's not measuring what it says it needs to measure. So you have to do a full evaluation.
Getting an accurate antibody test is complicated because people will have different levels of immunity, and it isn't known how long it lasts.
Given the severity of the situation, it makes complete sense that agencies like Health Canada are doing their due diligence.
That leaves us with swab tests to determine active cases of the virus. Crystal Goomansingh, Global News, London.
Since this pandemic began, Global News has been taking your COVID-19 questions to the experts. Lately, people have been asking about claims health products and home remedies might be able to fight the virus. So our Jeff Semple asked experts to separate fact from fiction.
This online video, allegedly produced by a doctor, claims to have found a cure for COVID-19.
By simply breathing in hot air.
It notes the coronavirus SARS was killed by temperatures of 56 degrees Celsius. So it suggests blasting a hairdryer up your nose.
Take slow, deep breaths.
The method was even promoted by a government official in Florida as a treatment option for those without medical insurance.
This sounds really goofy, and it did to me too, but it works.
But health experts don't agree.
That sounds like a very dangerous thing to do. You might dry out or even burn the very, very sensitive membranes that are actually there in your nose.
Social media is full of questionable claims, ways to protect against COVID-19, from using sunlight to gargling vinegar to drinking warm water every 15 minutes.
Completely untrue and not based on any science whatsoever.
The sun's UVC rays can kill some coronaviruses, but only at concentrated levels produced by machines like this one used to sterilize smartphones at Toronto hospitals. And while drinking water won't wash out the virus, it does help to stay hydrated.
We do know that if your airways dry out, it is easier for the virus to get in.
The Twitter sphere is also teeming with tips on immune-boosting supplements and vitamins, such as echinacea and vitamin C.
So there isn't a specific supplement or medication that's going to make you immune or even proven to decrease the likelihood that you'll acquire the virus.
An Ontario company even received this warning from American authorities after claiming a herbal tea works well against coronavirus infections. But not all home remedies are hopeless. Some studies, for example, have shown that gargling with an antiseptic, like mouthwash, might help against a respiratory infection. And of course, scientists are just beginning to study what, if anything, works against COVID-19. In the meantime, regardless of the product or the promise, they're asking everyone to do their research and make sure there aren't any negative side effects. Donna?
Jeff Semple in Toronto, thanks.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.